Hello and welcome to my channel. Today I am going to talk with you about ADHD. What is ADHD? ADHD is often diagnosed in childhood but usually lasts far past that. While it's still ADHD, symptoms can look different in kids versus adults. Please don't forget to like and subscribe. Whether you or your child has attention deficit hyperactivity disorder, which we call it ADHD, it can affect many aspects of daily life in childhood and adulthood. Many symptoms involve attention and focus. The effects of ADHD often go deeper and are more complex than that. And ADHD doesn't always look the same from person to person. For instance, you might appear absent-minded while someone else has challenges with organization or procrastination. What are symptoms of ADHD? We have three main symptoms: are inattention, hyperactivity, and impulsivity. ADHD symptoms typically show up at an early age, though they can become more noticeable when a child starts school. The average age of ADHD diagnosis is 7 years old. You may also be diagnosed earlier or later than that, depending on your symptoms and their severity. Most adults who are diagnosed with ADHD likely had symptoms from childhood that went unnoticed or misdiagnosed. ADHD involves a range of symptoms that are often categorized in three main types. These types are inattentive, hyperactive-impulsive. Combined means a combo of inattention and hyperactivity-impulsivity symptoms. Symptoms can change with age as children learn coping skills. Some people may also have fever or less severe symptoms as they get older, even without formal treatment. What are inattention symptoms? Many people with ADHD have ongoing symptoms related to inattention. According to the Diagnostic and Statistical Manual of Mental Disease, while males are more likely to be diagnosed with ADHD in general, females are more likely to have inattention type. To be diagnosed with inattention type ADHD, you must experience 6 or more of the following symptoms for 6 months or longer. What are these symptoms? These are: you have a hard time paying close attention to details, you find it difficult to stick with or finish a task, hard to listen or pay attention, it may seem like your head in the clouds. You have trouble following instructions, it's challenging to stay organized or manage your time. You often avoid tasks that require a lot of focus or mental effort. You lose things frequently. You're easily distracted by your surroundings or thoughts. You're forgetful. In children, inattention may look like having a hard time focusing on schoolwork or listening to lessons or instructions, or forgetting to do homework. In adults, inattention can look like trouble finishing work tasks on time, keeping up with bills, or getting organized. What are impulsivity hyperactivity symptoms? Some people with ADHD have symptoms that center around hyperactivity and impulsivity. As with inattention symptoms, you must experience at least 6 of these symptoms over a 6-month period for hyperactive impulsive type. You often fidget or have a strong need to keep moving. It's difficult for you to sit still, especially when you're expected to, like in a classroom or workplace. You're restless. It's hard to stay quiet in situations where it's necessary. You talk more frequently than others or speak without thinking. You find it difficult to wait. You have a tendency to interrupt others or find it difficult to take turns in a conversation. In kids, hyperactivity and impulsivity may look like leaving their seat in the middle of a classroom lecture or shouting out an answer before called on. An adult with these symptoms may find it different to sit still during work meeting, interrupt others when they are speaking, or always appear on the go and restless. Now let's see, what does ADHD look like in adults? ADHD can appear differently in adults. For example, hyperactivity in a child can present as restless in an adult. Some research suggests adults with ADHD are more likely to report having a lower quality of life. This was seen in people with hyperactivity and impulsivity, along with more severe symptoms. ADHD symptoms in adults may look like restlessness, acting impulsivity, difficulty focusing on work, trouble staying organized at home or work, problem following through, difficulty in task planning and managing time, anger, irritability or shifts in mood, trouble multitasking, difficulty managing stress. While most people are diagnosed as kids, some people with ADHD aren't diagnosed until adulthood. Still, ADHD doesn't start in adulthood. While they may not have been recognized or diagnosed, you'll have had symptoms as a kid. Like children, adults with ADHD are more likely to experience certain mental health conditions. For adults, these include personality disorder, substance use disorder, anxiety disorder, intermittent explosive disorder, learning disorder, obsessive compulsive disorder, or OCD. Adults with ADHD may also be more likely to have another neurodevelopmental condition like autism spectrum disorder. ADHD symptoms in adults can look like or be mistaken for other mental health conditions like depression and anxiety. Your doctor will likely ask you to think about symptoms you might have had as a child in order to figure out if it's ADHD or something else. Adults living with ADHD may experience unemployment or financial issues that impact other areas of their life, but many treatments can make it easier to manage symptoms and reduce obstacles. And while some people experience more challenges, other people view their ADHD as a strength. Some adults with ADHD find it makes them more creative or energetic in ways that benefit them throughout their life. You may ask yourself, should I get an ADHD diagnosis? If you recognize ADHD symptoms in either your child or yourself, you can start by reaching out to a doctor or mental health professional for a screening. If you're not sure where to start, you can also take quiz. There are many quizzes in the net that can help you. Just keep in mind that only a licensed healthcare professional can give you a diagnosis, so you'll still want to reach out. To receive an ADHD diagnosis as an adult, you must experience symptoms before age 12 that show up in at least two settings like home, work, school, or other activities that aren't due to other mental health conditions like anxiety disorder or depression. That can't be better explained by an underlying health condition such as thyroid condition. You might talk with one of the following healthcare professionals to get an ADHD diagnosis, such as pediatricians, if your child is getting diagnosed, psychologist or neuropsychologist, psychiatrist, primary care doctor. Now let's see what's next. Once a diagnosis is made, you can discuss treatment options and coping tools that fit your needs. One option is to consider is medication. According to the CDC, stimulants medication lessen symptoms in 70 up to 80% of children with ADHD. Non-stimulant meds, while slower acting, may also help some people. Behavior therapy can also help some kids learn skills and thrive. Therapy might focus on tools for managing stress, social skills, organizational skills, support for school-related needs, help with focusing and concentration. You and a healthcare professional can discuss what treatment approaches will be most helpful for you or for your child. If you or your child has been diagnosed with ADHD, many support groups and resources are available to make life a little easier. You can search in the net and find groups in your area. And please don't forget to like and subscribe.